So today we're talking about, is fibromyalgia caused by Lyme disease? And, you know, we've been doing a somewhat of a mini series on Lyme that's going to culminate in a no BS presentation that we're going to do here sometime probably in the next month or so. Yeah, next month or so. Dr. Gates is gathering the data. We are fortunate enough to have treated a lot of Lyme patients over a long period of time without prejudice to any type of dogma as to what it is or what it is not, poking and prodding and trying to understand why our fibromyalgia patients 8 years ago that we were started with were getting better when half of them were diagnosed with Lyme. One particular case stuck out in my mind. It came down from Washington. We're in Reno. Who didn't even come down for I forget what she came down with. It was like migraines or something like that. But she had fibromyalgia and we couldn't do anything with it, she said, because it was Lyme. We said, fine. Well, fine. That's fine. We're still probing. And Dr. Gates' his world of functional neurology is all about dizziness, vertigo, balance, migraines, those types of things. When we took on the case, fibromyalgia pain virtually disappeared and was able to be controlled. And she was kind of weirded out, as was her husband, as to how could that be, because I've been spending a lot of money, time, and effort over the last 10 years being in bed from Lyme disease. And they told me that no such thing as Lyme disease. There's no such thing as fibromyalgia. It's Lyme disease. So for the fibro is Lyme crowd. And for the no such thing as fibro, it's Lyme crowd. We're doing this presentation. It's not an in-your-face thing. It's not anything like that. Our opinions here, okay, and in our world, they're more than opinions, are basically rooted in not just research, because we're very aware of the lack of consistency and the different nuances and the different opinions and where the different motivations come for doing research. But if you understand how to look at research, it helps. If you have a background that allows you to actually evaluate research, it helps. Then if you have an ongoing clinical trial, which we have, which is to be treating chronic pain patients of every sort, short of cancer, and being able to observe what is happening, controlling certain factors, and then treating, and you start to come up with a clear understanding of what's going on, and that happens to sync with research, or that research happened to allow you to get there, you feel pretty solid. A lot of people say, well, you guys sound like you think you know everything. We don't. We know we don't know everything. And we know there's still a lot to know, but here's what we do know. We know that a lot of patients who've come in here with fibromyalgia were told they had Lyme, they couldn't be better or better. Better to the degree that they're out of pain, they're feeling 70, 80, 90% better, they're operating, they're living, they have jobs again, they're able to control and stay at that level, knowing what the tools are. None of it has to do with Lyme disease. So we're going to present that to you, okay? But we're going to present it even more because there's some new data that has come out that syncs. It coincides with what we're seeing, okay? And so we're just going to present that to those of you who may be open-minded enough to consider that maybe you become an expert in the wrong model of care. And that's what we see has happened. It's not an insult. It's not anything. I have fibromyalgia, okay? I've never been checked for Lyme, only because I'm a hard head and I was getting better without doing anything with Lyme. Just for a little background, I'm from New Jersey. I grew up in New Jersey. For those of you who aren't familiar with New Jersey, it's kind of like an island. It's like very wet. They call it the Garden State. And I used to pick ticks off me. My mother used to pick ticks off of me when I was a kid, when I would come in and you know, I've probably had a dozen ticks picked off of me in that time. And so the thinking would be, it's Lyme, you know, your thing was Lyme. But honestly, I've never been checked for it. And now I probably never will, thanks to that article. But in the back of my head, I always thought, should I get checked for it and see if they're just for edification of one more piece of data of I'm doing better. Do I have positive bands? And last week we did, or was last week or the week before, we did something on how we need better testing. And we do need better testing. And anybody who doesn't think we need better testing needs to really get into the evaluation procedure a little bit more and understand how inconsistent and unreliable it is. So is fibromyalgia caused by Lyme disease? And I must tell you, this surprised me.
No. The reference is arthritis and rheumatology. They took a huge cohort of patients, there's about 100 patients, who have what's referred to as post-treatment Lyme disease syndrome. Now, a lot of you are throwing your shoe at the TV already because you don't like that term. I will just say with the caveat, we understand all sides of this. We're not anti the ILADS group. We're not anti the CDC people. We try to look at it, excuse the term, in a fair and balanced perspective with our perspective as well and what we've seen. So we know all sides of this. So a lot of you out there are so dogmatic that, you know, fibromyalgia is caused by Lyme disease. Well, I'm sorry, but they did a huge study, and the criteria for the study were actually really good. And it was done by a research group where they are actively investigating answers for post-treatment Lyme disease syndrome. Meaning, most of you out there know that most doctors, or a lot of doctors, just blow you off when you bring up the whole chronic Lyme issue. Rheumatologists don't know what to do with you. Infectious disease specialists don't know what to do with you. You've been told that, you know, there's the acute phase of Lyme, you either killed or you don't, but this whole chronic Lyme thing doesn't exist. Well, these researchers who tried to examine a relationship between fibromyalgia and post-treatment Lyme disease syndrome, they acknowledge that post-treatment Lyme disease syndrome exists, and they're doing a lot of research on it, and they've actually made some pretty big discoveries in the area of testing that I will get into. But when they did a comparison of 100 Lyme patients, they only found that one of them met the criteria for having fibromyalgia. One, so that's 1%. So I'm sorry to say that fibromyalgia is not caused by Lyme disease. And we get it. We get that. Oh, so many of you are out there without answers, looking for answers. We talked about the testing 2 weeks ago. I'll kind of summarize that again. And so you go to the alternative doctors, the ILADS doctors, they tell you that, you know, your fibromyalgia symptoms that you've been experiencing really are due to Lyme disease based on their testing. We don't have an answer for that. All we can say is that maybe their testing is picking up false positives too. Now, I'm not saying there's no one who has Lyme disease and fibromyalgia. I'm not saying that. Right. I'm sure there's a crossover, and I've even discoursed with people via email who have been confirmed for having Lyme disease and who have fibromyalgia. So it's going to exist. But when we're putting these broadcasts out there and people are making blanket statements to us, basically that if we're talking about fibromyalgia, people will comment, well, you know, these guys are idiots unless they're checking you for Lyme disease. I'm sorry, but that's not a factual statement. And so that needs to be paid attention to. Now, in the world of Lyme, like we talked about 2 weeks ago, the testing right now is based in antibody tests, meaning they're looking for immune cells to the bacteria. It's now been shown that the Borrelia burgdorferi and the other species of Borrelia likely go into your lymph nodes, ruin the germinal centers, so your lymph nodes do not create an appropriate immune attack, antibody attack against the Lyme bacteria. That's one of the reasons why people can get second and third and fourth infections with Borrelia when you usually don't with any other infection, because your immune system will remember that bacteria, that virus, through antibodies. That doesn't work with Borrelia. And it's also been shown that autoimmune processes, the immune system gets imbalanced, we get inflammatory immune responses that occur when somebody is exposed to Lyme disease and they have the chronic forms of it. But the fact that the only way we test for Lyme primarily is through antibody testing needs to change. And that was the title of our video, because we're checking for antibodies that for the most part don't exist even when the bacteria is there. And furthermore, we attached a study to today's broadcast where they looked at patients who had the erythema migrans rash. 40% did not have positive antibody testing, even in the acute phase.
Wow. And he's talking to me like this because he just told me about this subject literally minutes before we started doing it. So this is
40% did not test positive via the CDC criteria when they should test positive. They weren't seeing any signs of IgG responses for the most part. They were mainly seeing IgM responses. But the take-home point is that 40% did not test positive in that first acute period. Now, we know the other side of it, and we understand the CDC criteria versus other lab companies and their criteria. But the point being is that if somebody has a rash, you would at least expect to see the antibodies. You're not going to see the antibodies. Right. Now, there's this research, forgive me if I'm butchering their name, it's Aucott, it's A-U-C-O-T-T, Aucott, and they're doing a lot of great research right now, and this researcher found a certain cytokine that's going up in chronic Lyme disease, so the post-treatment Lyme disease syndrome patients, it's called the CCL19 cytokine or chemokine. Chemokines and cytokines are like a little immune messengers. Think of our military, and we have all like the generals, and we have guys down here that send signals from one place to the next. The guys down here are called the cytokines, basically. And the cytokines within your immune system can go up or down depending on infectious illnesses. They can also go up and down in a certain pattern based on autoimmune illnesses. And this research group has now found that for the post-treatment Lyme disease syndrome patients, they're now able to identify you through a lab test, which is the CCL19 cytokine. That's a big, big discovery for a lot of you, because this is going to bring more validation to all of you who have post-treatment Lyme disease syndrome, chronic Lyme, whatever you want to call it. So diagnosis is important in the concept of, in the framework of Lyme disease. Blanket statements generally are not good without a lot of research behind them. And let's say if an alternative doctor is seeing a bunch of fibromyalgia patients who they find to have Lyme disease, I only question, or maybe some of these patients showing up as having Lyme disease with their testing because they're having false positives because of other bacteria or viruses that are becoming active in that individual's body. For example, Epstein-Barr can create false positives. Hep C, to my knowledge, can create false positives. We just had a case last week where the individual had hepatitis C, and they had a Lyme test, and so they were convinced that they had Lyme disease, and they didn't because they had hepatitis C. So it causes a false positive. So is this broadcast going to be popular? I don't know. Probably a lot of you it's going to anger even if you watched it, because it may go against the grain. But we got to talk about the facts. So if you have more facts, if you can find research articles that go against what we're saying, please send them to me. But when I did my literature search on this, comparing fibromyalgia with Lyme disease, that big article came up at Arthritis and Rheumatology 2014, demonstrating that there really is not a link. What were you going to say?
So some things that they might be thinking as they're listening to this. No, we don't check people for Lyme disease. I don't think we've ever run a Lyme panel, but we have just, you know, we do.
Have we run a Lyme? Oh yeah, absolutely. We run quite.
Well, there you go. So he doesn't.
Not meaning to disagree.
No,
with
but
you
I was going to say, I know I've seen scores
Yeah.
and scores and scores of Lyme testing from the people who come in here
Right.
from them already having been checked. All right. So what about people who get better? What about the people who go to the Lyme doctor and quote unquote get better? I don't know if I've never met one, but I've met people who said, well, I've been to this clinic for this, and they do Lyme, and their people get better.
Yeah, and what I would infer, because we've worked with other alternative doctors, when you go to these clinics, lots of times they're applying functional medicine principles. They're doing IVs of nutrients, vitamins, glutathione, vitamin C. If you have an autoimmune problem, vitamin C, for example, it's highly touted in the alternative community to bind to antibodies. I've actually seen it do that, where it lowered antibody values in a patient. So if you have an autoimmune issue and you're taking 25 grams of vitamin C IV, does it lower your antibody counts? Quite possibly, so people feel better, at least in the short run. Or if you're getting 20 grams of glutathione injected into your bloodstream and you don't make glutathione, and this glutathione vitamin C cocktail is part of an antibiotic treatment, you really don't know what's doing what. Also, antibiotics can be Th1 and primarily Th1 stimulators. So there are two sides of your immune system. One's like the Marine Corps, they do hand-to-hand combat. One side's like the Air Force, they do precision killing. And so with autoimmune disease, one side can be dominant. So you can take a drug, for example, that may boost up your weak side of your immune system. And we've seen that work to help people feel better. So there are a number of variables as to why somebody could go to an alternative doctor for a Lyme treatment and feel better, independent perhaps of the bacteria being killed.
Perfect. And I mean, that's going to be, my point was massive doses of vitamin D, glutathione dampens immune responses, that they're getting autoimmune problems better also. One last question. Okay, and this is a question for me. So couldn't Lyme be a trigger? So Lyme, well, we've talked about it. So Lyme can be and is a trigger for autoimmunities that ultimately result in a Lyme diagnosis because they get a Western blot, or this type of thing. So it can be a trigger that sets off immune responses, and then those immune responses can set off a variety of symptoms that are endless. If it happens to be your thyroid or your cerebellum or your gut or all three of them, or rheumatoid arthritis or any of these things, you can have 2 or 3 or 4 of those, and then it triggers and that gets set off. And then that can go to an ILADS doctor. And again, we're not against ILADS doctors, okay? But we're just saying, if what we're seeing is correct, maybe we don't have to spend $200,000 in 2 or 3 or 4 or 5 years on antibiotics, and maybe we can dampen an immune response in 4.5 months. For those of you who are like dogmatic or into this, like, no, it's this type of thing. Well, I understand we're talking to the wall there, okay? But this is what we have seen time and time and time again. And so that could be how that flow goes, right? Because these are the things I hear. These are the questions I get, you know,
Right.
and that would be how that flow would go. So people could get confused and go, yeah, but I got the rash, and then I got the fever, and then I took the antibiotics, and boom, this whole thing blew up, and then it's Lyme. Whereas indeed, it actually set off oblique autoimmune problems, and then that's the problem. And that's why they're taking 6 years worth of antibiotics, because it's actually an autoimmune problem. Or they go somewhere and they do a lot of this, they basically throw everything in the kitchen sink at these folks. And we get it, the dark field microscopy and all, but they all lead to this kind of like throw everything in the kitchen sink at you. And some of it in certain people is going to dampen immune responses and help them to improve. Right. Would that be fair?
That's fair, yeah, because the whole thing is now everybody out there, you know, a lot of you know about the studies done on Lyme arthritis, and there's, I don't want to use the right term. There are videos out there, you know, talking about maybe some bad motives by some researchers who researched Lyme early in the 90s, you know, to create a vaccine and things like that. We understand that a lot of you think, okay, there's the Lyme arthritis thing, but then most of us have the immune suppression neuroborreliosis problem. But then they did the study. So neuroborreliosis is you have Lyme disease, it creates neurological symptoms. And they did a study where they went in, they looked for neuroborreliosis in the cerebrospinal fluid of 100 patients who thought they had it, and they found it, I think it was like less than 10. I want to say it was around 5 individuals actually had it. But again, the way they're looking for it is through what? They're looking for it through antibody tests. And this bacteria screws up your ability to make antibodies. So the point that Dr. Rutherford is making is that the new research, first it came out in Journal Autoimmunity 2016, then we attached another one, I can't remember the journal, is from this year, where they're showing that your immune system gets very imbalanced and promotes an autoimmune type of physiology when people are in this chronic Lyme state. And know that when I talked about these cytokines are hugely important, because like when you're sick, let's say you have a cold, what do you feel like? You feel a little depressed, you don't feel as good, you don't feel as confident. Men lots of times have dreams about low masculinity when they have a cold. Well, that's because all the immune inflammation through the cytokines go into your brain and actually cause your brain cells not to work as well. Well, if you have an autoimmune problem, guess what? The same thing happens. Go watch our broadcast on brain fog, because all patients who have brain fog have an autoimmune or an allergic problem. So it's immune inflammation secondary to the Lyme issue, autoimmunity, that floods the central nervous system. And that's a big reason why so many of you have neuroborreliosis symptoms. It's really probably because of autoimmunity. That's what the research at this point in our clinical experience points strongest to.
So the goal here is not to make the fibro is Lyme crowd wrong. It's not to make there's no such thing as fibro wrong. The goal is to change the narrative out there. Okay, the goal is to change the narrative. Doug Gates has a passion for this, and when I say that, I mean he just does a tremendous amount of research, because the things that we see in clinical practice don't necessarily coincide with fibro is Lyme. It doesn't necessarily coincide with there's no such thing as fibromyalgia, since we see it all over the place. Okay. So it's a poor term to describe what's going on, and they probably should change it to make it more relevant to what people are starting to understand fibromyalgia is. So the goal is to change the narrative. And I must say, if my observations are correct, of 3 years of doing this, we don't charge to do this. We're not asking you to agree with this. We don't actually care. All we care is if our patients get better. That's it. Okay, but we're sharing it with you. And in the end, you know, I think the narrative has changed in a lot of ways. And I think some of the narrative has changed because of some of the research that's being done here, because some of the things that I've never heard before, all of a sudden I'm hearing sometimes weeks and months later in areas of influence. And so it's kind of interesting. I've never heard it before. We talk about it, we get attacked, and then all of a sudden 2 months later, I hear somebody talking about it in a research paper or on some sort of a popular television or something like that. And I'm not exaggerating. So we're trying to change the narrative in a way to we don't have a huge population of Lyme people running around there for the rest of their life going, nothing can grow. I got to take all these medications. I'm going to have this forever. My Lyme, my fibro, I have to learn to deal with it. I have to learn to like accept it. I have to learn to embrace it. Fine. If you have no other tools, do that. I mean, I'm for anything that makes your life feeling better, but this is important data, and we're not doing this to sit here so that we can like hear ourselves talk. We're doing it to present it so that it can be considered. There are a lot of different motives as to why it might not be considered, but so that can be considered by the people who are serious about getting this condition understood, under control. It's probably not curable, but you probably can get the tools to dampen it, to control it, and to keep it under control and live a relatively normal life without you having to spend the amount of money that people come in here and spend is beyond my comprehension before they get here. It's like, that's the intention. So don't start throwing tomatoes at your little things and stuff like that. Just if you either agree with it or you don't, either one's fine. So that's the intention, to change the narrative into a direction that will come up with a successful solution that can be embraced by the entire community, that can be presented to the folks who are suffering so much. So.
Yeah, and if you want our articles for today, go to powerhealthtalk.com, scroll to the bottom of the page, the articles are attached. Again, read that research article, Arthritis and Rheumatology, if you have interest in this, 2014. And anything else you want to add in?
No.
Okay.
No,
so
good.
we appreciate you watching. We'll be back next week, and we'll talk to you soon.